So thank you very much for having me here. It's an honor to be speaking with you. And thank you, Ishido.
Sure.
Thank you very much. So I'll talk about some of the work our center is doing at the intersection of big data, AI, and mental health. And usually we think of mental health and well-being to be flip sides of the same coin. If you have a really good well-being score, then it is very likely that you don't suffer much with mental health. Right? So these are anti-correlated terms. In the US, we traditionally had more funding for mental health because of National Institutes of Health and so on. So we focus more on mental health and look at well-being together with mental health. So this is my background. I did my undergrad in India, in Bitsplani. Then I went to Singapore, spent 4 years doing my PhD. I interned at Panasonic for about a year. And then now I'm an assistant professor at UPenn. I work in computer science, but a lot of my work is at the intersection of computer science, health, and psychology. So that's where I work with the World Wellbeing Project and the Positive Psychology Center at UPenn. So this is the first question we start with. Is mental health really real? Right? So growing up, a lot of us might have heard, oh, it's all in your head, you're basically making it up, you can snap out of it. Mental health is not really a thing. Right? So don't be so dramatic, you can snap out. But we've seen that mental health has real consequences. This is some data from Japan, I think recently post-COVID. You sort of see that almost 1 in 3 high school students are reporting to have moderate to severe depression. Right, so 30% is really a big number. And beyond diagnoses, these also have real consequences. For example, this is a really small graph, but this was published in 2021 in JAMA Network Open, where the authors were studying the rates of suicide events in Japan. And you sort of see that first time in 2020, after almost 5 decades of reducing rates, the suicide rates have actually increased, right? So, and you sort of see that it's more prevalent in women compared to men, and it's also more prevalent in middle-aged people. So ages 30 to 49, the orange graph is 2020. You sort of see that it's higher than all other graphs, right? So mental health has real consequences, and the idea is, can we use big data and AI to understand mental health before the bad consequences actually arise. Right? So I'll try and talk about a few different studies in summary, but an underlying theme of these studies is loneliness, where loneliness is not necessarily being physically alone. I might be with a lot of people and still feel alone. Right? Whereas I might be by myself and yet not feel alone. Right? So we are talking about the first construct, which is a psychological construct, the idea of feeling alone even when you are with other people. And some studies sort of suggest that almost 1 in 3 young adults feel alone. Right? So again, 30% is a pretty big number. It's in the US, the Surgeon General recently said that this is a public health threat to the country. Right? And there are multiple studies that sort of showed that higher loneliness is associated with higher rates of depression, dementia, insomnia. And what is sort of interesting is it increases the risk for cardiovascular disease by almost 30%. Right? So if you're feeling alone consistently, the risk of cardiovascular disease is almost increasing by 30%. And some studies have actually pointed out that this is as bad as smoking 15 cigarettes a day, right? So it's pretty bad for one's mental health. But still, it doesn't really receive a lot of attention in the healthcare setting. For example, you go see your doctor, the doctor might ask you a few questions around depression and so on, but they don't really ask you about, oh, are you feeling lonely? Is there something about the social capital that we can do to address, right? So what can we do about this? Number one, we'd have to do anything about any condition. A lot of you are economists. You'd have to measure, right? Without measuring, we can't really do anything. But once we measure, we will be able to validate it and develop interventions to then, improve the measures. Right? So we've sort of used social media as one of these data sources. If you want to take a guess, how much time do you think a lot of young adults, none of us in this room maybe, are spending their time? How many hours? Any guesses? Either 20 to 25 to 34 or the first bar.
I don't know, 6 hours.
5 hours.
Startup, yeah. Right? So this was in 2018. It was about 3 hours,
3 hours.
Which is sort of I think a conservative estimate. But now with TikTok and other pieces, these numbers must have gone up really, really high. And if you compare that to, on the right, I have this small icon about a doctor and a patient. In the US, we usually see the doctor maybe 3 times a year. In Japan, I think that's a little higher, about 10 to 12 times a year, because of good insurance and the healthcare facilities, right? But you sort of spend all this time online doing either posting images or posting text images or about cats or about your other social life. Can we use all this time you're spending online to inform your healthcare or health visit, right? So that's one of the questions we are trying to ask. So this is the agenda for today. I'll talk about digital mental health broadly, and then I'll cover 2 challenges. One is, how do you validate the measures that you get from social media? Because as we know, social media, most of us think, oh, people are just posting about their best lives. Right? So there's a social desirability effect. So you're only talking about what is good in your life. Can you still use this to understand health and well-being? And number 2, are there cultural differences in how these health metrics manifest? Right? So for example, everybody is different. So can social media give you that culturally nuanced picture? Again, the goal of all this is to build translational AI. Right? So we want to do social good, and the idea is to have real-world impact. We are not really worried about building models for the sake of models or building algorithms for the sake of algorithms. So this is the first question. How can mental health be measured unobtrusively using AI? Right? So you've done surveys in your studies. Obviously, question you can ask, for example, PHQ-9 or Beck's Depression Inventory or certain survey questionnaires, and you can measure mental health. But often these surveys take time. For example, if you go to roll out a survey today, you'll get responses maybe in a week, and you don't really have that real-time nature of it. Right? So can you use passive sources to measure mental health unobtrusively? That's the first question. So can you use social media? So we've looked at multiple types of social media data. Twitter, maybe all of you heard of Twitter. Reddit, anybody has heard of Reddit-ish? Maybe yes. And also Facebook. Right? So typically, we've looked at 3 different ways of collecting this data. One is we give the surveys, so PHQ-9, UCLA-10, BDI, which measure either depression, loneliness, and so on. And we also ask these individuals to share their Facebook data with us. Right? So we have 4 to 5 years of Facebook data and a couple of time points of their survey reported data. Right? So we have almost 5 years, meaning about 1,000 to 2,000 words for each person, and how they're feeling at multiple time points. And then on Twitter, in the US, this is especially prominent. You just go on Twitter and say that, oh, I have been diagnosed with depression, right? You don't see this a lot in, for example, we've tried to look at this in China, and we found out of 1 million people, maybe 7 people, right? Whereas in the US, we tried this and we found thousands of people going online and saying, I've been diagnosed with depression. So this is self-declared health status of how people are feeling. And with Reddit, there are multiple subreddits. For example, Japan has multiple subreddits. For example, for tourism, there is a subreddit. For residents, there is a subreddit. For immigrants, there is a subreddit. And then there are also subreddits for depression, loneliness, well-being, and so on. So you can see who is posting where and sort of get a proxy of how they are feeling and how they are doing across different conditions. So this is one of our first studies that we published looking at Twitter, basically expressions of loneliness, which is an observational study. I'll talk about this a little. So we started with basically these public expressions. Here I give you a couple of examples. Oh, I'm so lonely and bored right now. I need some type of love or company, right? So that's an example. I'm always the only one up around this time. So we basically look for the phrases alone and lonely and looked across the US. And we found about 76,000 people talking about loneliness or being alone. And a lot of these are also likely song lyrics, right? So for example, there's a very famous song called Lonely, right? So somebody might just post the lyrics of the song, and they might also come up in the 76,000 people. So we want to be cognizant of who is authentic in their expressions versus spam ads, song lyrics. We remove all of that, and that gave us about 6,000 people, right? And of these 6,000 people, about 60% are women, and the median age is pretty young, about 21 years, right? So what do? We identify these 6,000 people. We download their timeline of tweets, which is about 3,200 tweets per person. So that is about 17 million tweets total. And we remove retweets and so on, and we look at only tweets between 2012 and 2016, because 2016, Trump got elected in the US, so we didn't want that to be a confounder in how people are talking about. And so this is our lonely group, and we also have a matched group. So language, as you might know, varies with person's age and person's gender, right? So we want to control for these demographics. So we create a matched control group who do not talk about loneliness. They never post about being lonely or alone, and they have the same age and gender distribution as the lonely, right? So we have a lonely group, a control group. Now we have a pipeline, basically a natural language processing pipeline. So I'm a natural language processing person. So we tokenize or we split the text into words, and then we build what are known as topics. So you might imagine, people use a lot of words, right? The vocabulary of words is really high, but people use a lot of words very rarely, right? So there are only few frequent words. So the idea is, can you cluster all these words into a smaller number of topics? And those we call LDA topics. And then we correlate them with the lonely group and non-lonely group. And we also build a machine learning model to see if language can be used to predict if somebody is lonely or not, right? So that's the overview of the methodology. So this is what we find for the lonely group, right? So you see a lot of I talk, self-referential talk. I, me, myself, I need, I want, I can't, right? So there's a lot of self-referential talk, and individuals are also talking about relationship problems, right? So relationship, lonely, and so on. And there's also a little bit of swearing, so using curse words and so on, right? So which is a classic feature of emotional dysregulation. And this is what the control user group looks like. If you use Twitter, you know that people can tag somebody else using @mention and their user handle, right? So we masked all those in using this user phrase, and that is the biggest predictor of the control. So essentially, people who are having conversations on Twitter are not lonely, right? Which is like a duh, what else would you expect? But this was sort of interesting in retrospect. And people also use a lot of language which is positive. So thanks, amazing, thank you. And they're also talking about going to the game, right? Going to the ball game, or celebrating birthdays together, or offering congratulations to each other, right? So there's this positive language overall in the control group. So, and if you use all of this language together and just put it into a machine learning model, again, we have a match sample, right? So 50-50% balance. the machine learning model does predict almost 80% of the time accurately whether somebody is lonely or alone, right? So just using somebody's language on Twitter, 80% of the time you can say whether they are lonely or alone reliably, right? So we're not using any other features, which is sort of interesting. So that's one, but if you worked in the health domain, you know that 80% is not really a good accuracy, right? It cannot be used as a diagnostic. So can this provide any insight into how mental health manifests, right? So this is a work by one of my postdocs, Ting Lu, who's a psychologist, where we were looking at language of loneliness and how that varies with depression, because a lot of studies have focused on depression, and loneliness is sort of seen as a symptom of depression. But often, if you have to develop interventions which are very specific to loneliness, you'd want to know what is the uniqueness of loneliness and how is it different from depression, right? So that was the overarching goal of this study. And we followed a similar data collection pipeline. We collected we approached about 3,000 individuals with Facebook, and they took the UCLA loneliness questionnaire, and they also took the PHQ-9 questionnaire to measure depression. And we extract several language features, and we see how they correlate with loneliness and depression. So this is how, on the left, the yellow ones are the risk and protective factors for loneliness. On the right are the risk and protective factors for depression. And you see that there's a lot of overlap, right? Higher loneliness and depression are talking about negative emotions, sickness and pain, a lot of, again, first-person pronouns, I, me, my. And lower loneliness, people are talking about, again, birthdays, positive language, going to the game, social activities, and relationships, and so on. But where do these differ, right? You sort of see that for protective factors in depression, while social activities or gatherings are good, so if you go to the ball game or if you go to the games together, that is protective of depression. But you need meaningful relationships to be protective of loneliness, right? So gatherings themselves will not work. And for the risk topics, you sort of see that there's negative feelings, pain, and sickness for depression. But when you control for depression, the loneliness topics are more higher cognition. People are talking about reading or spending time alone, and for example, unusual observations and mixed emotions. It's not all negative, right? So as you might expect with loneliness. So what does it mean, right? All of that is social media language. Can you really trust those findings? We've seen that papers by Cacioppo and so on, who are leading experts in loneliness, also found similar sort of findings. Right? Loneliness was linked to higher cognitive and information processing pieces there. And what is at the core of loneliness? It serves as a protective mechanism against unpleasant social interactions. For example, if I'm anxious that I might mess up in this social interaction, I would rather be alone than engage in this. Right? So loneliness is sort of acting as a protective mechanism in one's psyche, which we sort of see in higher cognition and information processing topics. Similarly, it's negatively associated with language related to close relationships. Right? If somebody has meaningful and close relationships, they're less likely to be. Right? So the idea is, if you were to target loneliness, you'd want to focus on these two. Try and create initiatives that encourage positive social experiences, be it for students or adults or anybody else. And the idea is to give individuals an opportunity to face those awkward social interactions, right? So that fear of social maladaptive social cognitions is reduced. So that's all at the level of individuals, right? So we recruited people, specific people, 3,000 people, and then we looked at those different correlations and predictive models. But could we scale this up to communities, to regions, to prefectures, for example, right? And we sort of did this during COVID, where we've been collecting about 5 million tweets every single day. And we have scripts that map them to different counties in the US, different prefectures in Japan, for instance. And we've also done some work in India and UK. And the idea was, now that you have an individual level model that can predict loneliness, we can basically apply this to regional Twitter and then get estimates for loneliness, depression, and so on at the regional level. So this is an example of how things changed during COVID. March 11th, I think March 12th was when the national emergency was declared in the US during COVID. And the green line here is Twitter estimates of loneliness in 2019. And the orange line is the Twitter estimates of loneliness in 2020. And the y-axis is essentially z-scores, right? So you sort of see that loneliness in 2020, as estimated by Twitter, is almost 2 standard deviations higher than loneliness in 2020, right? And you sort of see this immediately, right? Within a month, you see these fluctuations or peaks in loneliness, which Twitter could give us. If you were to do the same thing using surveys, it would take you multiple months of collecting data. So we have similar models that can use language and estimate somebody's depression, anxiety, stress, sentiment, suicidal ideation, life satisfaction. We have a bunch of these models, and we have also validated them against Gallup. Maybe you know about Gallup, which is it runs these surveys across different countries, and they also call people and ask people how they're feeling and so on. So we use that as ground truth. And then we made this dashboard during COVID. This was live for about 2 years, where we were injecting about 10 million tweets, processing them in the back end, and then getting estimates for anxiety, getting estimates for how different counties are doing, how different states are doing, and what are the top mentions of symptoms during COVID, and how that has changed over time. And then we got a bunch of press, but that's fine. But what was sort of interesting is the Department of Health in Washington State, which is not the state we live in. I'm in Pennsylvania. But these folks reached out to us, and they were like, oh, we want to measure the health of our counties. Can we use your estimates to measure the health of our counties? So we made all of these open source. We made them public. And then they were able to do these analyses over time using our Twitter estimates. And you sort of see, so we shared 3 different estimates. One is positive sentiment. The second is loneliness. The third is anxiety. And you sort of see that immediately after COVID, loneliness increased. And the big dip here is around the killing of George Floyd. If you are aware, a Black man was killed by police officers brutally, and that led to mass protests across the US. And you sort of see sentiment going down drastically around that time, and then again picking up, right? So it sort of gives you a real-time pulse into how different counties are doing. Now, again, we use surveys as ground truth, right? But do we really trust these models? Do we know if these models are valid, right? That's the second question. So we went to Penn Medicine, which is a health system that is attached to the University of Pennsylvania. And then we asked the patients there to see if they can consent sharing their social media data and also their electronic health records, right? So electronic health records are essentially any visit to the health system is logged in the EHR. So we now have 7 years of health records and 4 to 5 years of Facebook data for different people across the same time, right? Now you can do a bunch of different analyses because you have this longitudinal data. So we have about 6,000 patients who consented to sharing this data. So, but the consent rates are low, right? So of every 100 people we approach, only 30 people share their data. And there are about 50 million data points on this sample. So using this data, we were able to predict depression 6 months in advance. Just using Facebook language, we were able to predict depression 6 months before it was diagnosed in the health system, right? And we were able to, for example, forecast hospital utilization, forecast superutilization, and so on, which are all key markers to sort of forecast in the US health system anyway. Okay, so these models sort of work even in the EHR data. And then this is again work by Lai Langer and other colleagues that you might be familiar with, where we collected oral transcripts of individuals who were survivors from the World Trade Center accident, right, 20 years after the incident. And then the same models that were trained on Facebook and Twitter were predicting anxiety, depression, loneliness among oral transcripts in a completely different sample, right? So what is sort of puzzling is social media models are able to predict these mental health estimates on entirely different set of data modalities, which is sort of interesting, including SMS. So that was the first piece. Now let me go to the second piece, which is talking about cultural differences. Right, so this is ongoing work where we're looking specifically at China and India because we have a lot of data from these countries. We looked at Sina Weibo. Maybe you might have heard of Weibo. It is basically China's Twitter, right? And we were trying to see if we can understand how psychological stress manifests in urban and rural places. And we also wanted to look at how for example, mental health is different in India compared to other places in the world. And the core idea here was, I was part of what is known as the World Wellbeing Project, but all the papers were published only on the US, right? It was more like US Wellbeing Project and not World Wellbeing Project. So I was like, maybe we should bring the world back into the World Wellbeing Project. So that's when we sort of looking at places outside the US. And these are a couple of examples. So I'll briefly touch upon India because it's sort of an interesting economy. The treatment gap for mental health disorders is almost 95%, right? So that means that of 100 people who need treatment, only 5 people get it, right? It's a pretty bad situation. So what we did was we looked at Reddit and we essentially looked at a bunch of different mental health related subreddits. For example, here I just show a few of them. So depression, self-harm, bipolar disorder, anxiety, suicide watch, and so on. And we also see which of these people are posting in India-related subreddits, right? So there are a bunch of India-related subreddits. Now the idea is when somebody posts on India-related subreddits and mental health subreddits, these are potentially Indians who are talking about their mental health. Right? And then we also have control groups who are posting on depression and so on, but not from India, right? So that's the rest of the world. So briefly, how are mental health concerns different in India, right? In the rest of the world, people are talking about academic and work-related stress, right? That's the single biggest driver of mental health. The second is people are talking about relationship issues and so on, which is also present outside India. But in India, it is relationship struggles with people who are living, right? So you're living with your family and you're unhappy. Whereas in outside India, you're not necessarily talking about people who are living. It's mostly around family and grief where people are talking about older people. And there's also a lot of discussion around medications and SSRIs and so on, which is not so much present in India because of stigma and taboo and so on. So something like this can be done for any specific culture, and sort of Reddit gives you that opportunity, is the point of trying to make. And the third piece is around China. Again, here we're looking at provinces and city counties, right? So China, I think, has about 31 provinces, rather, we have data from about 31 provinces and about 320 city counties. And we were looking at how stressors are different in urban and rural areas, right? And the interesting piece here is this is entirely Mandarin and a little bit of Cantonese, right? The natural language processing pipelines can be adapted to different languages pretty seamlessly, as you see. So what do we find? So the left is stressors in urban areas, and the right is stressors in rural areas. I have the English translation beside the Mandarin words. Essentially, you see in the urban areas, people are talking about, economy a lot, as you might expect, and about universities and medical facilities and so on. Whereas in rural areas, there's a lot more personal, emotional language, right? People are talking about, for instance, family and anxiety, tears and love, and crying and so on. So there's a lot of personal language that you see in rural areas, which is completely absent in urban areas. And we also look at topics, which, as I mentioned, are clusters of words. And in the urban areas, you sort of see this broad discussion around, governance and society and unhappiness with the government and so on, or finance and economics. Whereas in the rural areas, again, there's a lot of emotions and experiences and, health and body and dissatisfaction. So there's this huge urban and rural divide. And we also validated these against Gallup, which is, again, World Poll Data Survey. And you sort of see that, the stress measures align with general stress measures. And, I think the urban areas also speak less about pain, which I don't think I mentioned here. But anyway. So those are the studies. But at the same time, there's a big caution here that we are looking at these societies as if it is one whole homogeneous entity, but there's a lot of variation within society, right? So for instance, this is a recent paper by another postdoc of mine, where we were looking at the racial differences in language of depression. For example, one of the key findings in my prior work was whenever somebody is lonely or depressed, they talk about themselves a lot, right? So I usage is very high. I, me, myself. And that is something we also found in this data set. For example, here, as depression severity is increasing, I usage is increasing. But if you break it by the two racial groups, the blue is the white Americans, the orange is the black Americans. And you see that the first graph is entirely being driven by the white Americans, right? So when you use data which is skewed towards the majority class, you are less likely to capture the nuances in the minority class, right? So the idea is we need to be a little cautious about the presence of heterogeneity, which has actually far-reaching consequences even in ethics, for instance, because increasingly the idea is, can you use AI to predict both population and individual level health? And if the models are trained on a homogeneous group of people, then you will not be able to apply them on the smaller subsections. It could be socioeconomic people or otherwise, right? Or it could be urban, rural, it could be income, it could be education. There are a bunch of these protected classes that we need to account for. And there's some ongoing work in Japan. Maybe Lyle presented this. I don't know. Some of you might have seen this. But we also have Twitter from Japan. It's about 6 million posts covering, I might have messed up the words, but maybe 10 provinces and 47 prefectures. Is that correct? Correct-ish? No?
That's 47.
47, okay. And 10 provinces, is that right?
Yeah.
Okay.
Yes.
Okay, I'm glad.
We rarely talk about provinces. We always talk about prefectures. So that's why we cannot. Oh, how many provinces?
Okay.
Right.
So it might make sense to look at prefectures and not provinces. So we also have from Gallup, a bunch of responses like, the demographic distribution, amount of sleep that people have in these different prefectures and so on. So we try to see if we can get some insight into this, and you sort of see this. So this is basically correlation with age. The ones on the down are younger, and it's going older, right? So sorry about that. The first is cute, so much envy. That's the predominant topic. The second is talking about, candy and snacks and so on. There's this other age group where you're talking about health and bodybuilding and so on. And then as you grow older, maybe you're just talking about weather, right? So, I mean, there's a little bit of a stereotype, but you sort of see these interesting correlations, which are, again, statistically significant, right? And then here we look at single versus married, right? When somebody's single, there's this language around rock music and do-it-yourself and hobbies and getting hurt doing those things, and watches and fantasy works. Whereas when somebody's married, again, there's a lot of talk of weather, a lot of talk about traveling around and watching family-friendly comedians and so on. So there's this distinct language footprint between single and married individuals. Again, I might have some of the words might be off because of the font we use, but the core idea is that. And then this is one of the pieces with sleep, right? So I don't know if anybody is familiar with this animation, but we found that there was this distinct language of Tanya the Evil, which is negatively correlated with sleep time. So this apparently airs every day at, I think, midnight, or used to air anyway. So people who are talking about this are not sleeping, obviously, right? And the second piece is when somebody's talking about morning jogging, then that's also negatively correlated, right? So you sort of get these interesting insights using Twitter language at different languages and so on anyway. So there are a bunch of different open questions that actually I wanted to discuss. So as a part of our ongoing work, we are trying to see how, for instance, mental health and happiness varies across countries. And we have a few hypotheses that, for example, there's this psychological manifestation of mental health and somatic manifestation of mental health, right? So for instance, in the US or in the West in general, it is completely okay for somebody to come and say, oh, I'm just feeling low today, I don't want to come into work, right? You're not really looked down. But I have never seen, for example, my parents say that, oh, I'm just feeling low today, I will not work, right? It is just not acceptable. But often you see that this manifests in other ways. For example, oh, my knee is hurting today, my stomach is hurting today, my head is aching today, right? So there is a somaticization of mental health, which seems to be more prevalent in the East compared to the West, right? And when you also look at Gallup and World Values Survey and other well-being measures, you sort of have this paradox that Japan is a very rich country, right? But in all of these surveys, it ranks lower in happiness. And we're not sure if it is because of the way people ask the question or if it is the response itself, right? For example, we were talking this morning that somebody is, if you were to ask me on a scale of 1 to 10, how happy are you? Maybe your 10 is my 7, right? There are these cultural differences on how much is acceptable to rate oneself, right? So is there something we can do in how these questions are phrased so that we can get calibration on populations? Again, we were talking earlier this morning. Can you, for instance, ask somebody, if you were admitted to the University of Tokyo, how happy would you be internally, right? Can you use that as a calibrating question? And when you're doing the same study in the US, if you are admitted in, say, Harvard University, how happy would you be, right? If somebody says a 7 here and a 10 here, maybe 7 is equivalent to 10, right? That way, when you're looking at country-wise variations, you're actually adapting these questions to the different countries, right? So the second angle to that is when you're doing these social media-based studies, right? We are often looking at words related to happiness. So, for example, happy, enjoy. There are other words that sort of mean the same, but not exactly are the same, right? Can you sort of get culturally sensitive words to sort of measure well-being in different cultures? So that is, again, an open question that we are looking at, partly to understand how these different well-being measures vary across cultures, and can you do a better job than, let's say, things like Gallup and so on? That's the broad idea. So that's, I'm just trying to summarize now. So we have some ongoing work where we're trying to work with older adults and applying all of what I've just discussed to developing interventions. But I'll skip that. So we're also developing actually conversational agents after the rise of ChatGPT and so on. Now you can build conversational agents that can understand how somebody is feeling, and B, try and see if you can improve or remove their factors of resistance, right? So if somebody is resisting to seek help, can you use conversational agents to remove that resistance? So we have some ongoing studies. This is actually a public chatbot. It's still under development, but we have a couple of different applications, one being mental health. The other is teaching English as a second language. So we are looking at both of these applications using conversational agents. So anyway, takeaways, I'll summarize. So language data is a great low-cost resource, right? For all of this, Twitter was free, at least before Elon Musk took over. Now we no longer have access to Twitter. But before that, all of this was free, and we were able to look at differences across countries, across cultures, across languages, and it was a pretty real-time estimate, right? And second is a lot of these conversational agents and tools could be a great resource for understanding well-being and also breaking stigma to sort of seeking help. Right. Those are the 2 points I want to emphasize. And these are the collaborators, Lyle, you might have heard of Johannes. There are a couple of clinicians. Louis Tate is a psychologist at Purdue. We worked with Ed Diener and so on, and Brenda Curtis at NIH. And that's my team, and arigato gozaimasu. Thank you very much for your...
Well, thank you so much, Dr. Sharath Guntuku from University of Pennsylvania. So, I really, appreciate your easy to understand way of explaining about this concept of well-being and also in connection to the state of the art, like technology, issues, like chatbot and maybe ChatGPT. As well as we were talking about this programming language of Python. So you are such a highly technology oriented person, but it was really easy to follow type of issue that you introduced this morning. So thank you so much. And then yeah, lots of questions might be coming from our side. So yeah, would it be possible for Professor Kobayashi first to just make some clarification or comments, and then of course we wish to open the floor for a lot more conversations with Dr. Guntuku, and then Professor Kobayashi will also give his own presentation from our side, what we have been doing here, and etc. etc. So that's a setup for today. Well, thank you so much, Professor.
Thank you for the impressive presentation. Actually, I have a quote with some members of the member.
Yes.
So I'm very happy to use the presentation today. So I would like to introduce your name to Japanese audience. So what's the exact pronunciation? Shara Chandra Guntuku.
Yes, perfect.
Shara
Chandra Guntuku. Yeah.
Chandra
Guntuku. Yeah.
Okay. Okay. I meant it.
Yes.
And so some of which contents you presentation we have been with. So I would like to ask from here. So you talked about your endeavor to develop AI treatments like that. My first question is, what's the present stage? Is there still investigation going, or some application have already been started?
Oh, yeah, excellent question.
Right.
So we often find that AI-driven mental health models are good risk assessment systems, but they are not ready for diagnostics. Right? So we cannot replace doctors. It is A, ethically wrong, and B, methodologically flawed to replace clinicians with, or therapists for that matter, with AI. But what AI could do is, for instance, I was talking about India, where the treatment gap is 95%, right? So AI could potentially identify individuals who need treatment, right? Even in the US, the health system is very burdened. There are not enough doctors, but a lot of patients, right? So can AI be used as a first level of risk assessment tool? And that's where we are trying to work with Penn Medicine as a start to see if some of these tools can be implemented into EHR and so on. So there is an application part to it, but it is not diagnostic, or AI is not the final say.
Right.
It is to help the doctor.
In this invitation, your team are being collaborating with some doctors, like
Yes.
Psychologists, or
Yes. Both. Yeah, both. So psychologists and clinicians. So, for example, here Rena Merchant is a clinician. She directs the Center for Healthcare Innovation at Penn Medicine. And Johannes and Louis Day, both of them are psychologists. So yeah, we work with all three.
So is there any relation with the positive cycle?
Martin Seligman?
Right.
Oh yeah. So we this is actually an interesting story. So I went to Penn during the last year of my PhD, and I was in the Positive Psychology Center with Lyle and Martin Seligman, and we talked a lot about population health, but not so much about individual health, because one of the things that Martin Seligman has been asking a lot of his postdocs to try is, you're seeing these differences in language. You see that words make a big difference in people's health. Can you change the way people talk to see if that impacts their health, right? So for example, if you know that if you talk a lot about yourself, it is associated with bad mental health outcomes. Can you make people not talk about themselves and talk about groups of people, maybe use things like we and so on, and see if that improves people's health, right? So it's a very ambitious idea, but we are still figuring out how to operationalize that, right? So it's not entirely obvious how do you make that transition happen. So yeah, we are in talks with Dr. Seligman, but more on the public health side.
Okay, I see. My second question is concerning culture too. So this is really a very interesting battle through your Japan. So I'm impressed by your presentation concerning Japan. So how do you proceed the project in Japan?
So that's actually a very nascent stage at this point. We have a lot of data. So we have almost 12 to 15 years of Twitter data. So starting from 2012 all the way till 2010 to 2020, almost 10 to 12 years of data. And we are able to map these to different prefectures and so on. Now, we are not entirely sure, for example, we have a few Japanese-speaking students, but we are not experts in the country itself, right? So how do you get ground truth data around, let's say, well-being? Or is there, because Gallup does not give you a very fine-grained data for different prefectures and so on. So are there ways to identify culturally nuanced data, then which we can then map to Twitter and do something that we've done in the US multiple times?
So the analysis is now US Pennsylvania, now in Japan.
Sorry?
Not in Japan, but Pennsylvania.
Yes.
Really?
Yeah.
So some Japanese
undergrad students, yes. Yeah.
I'm discussing the possibility of collaborating such kind of project rather than I'm afraid we haven't seen that yet. So but now that we not I think that we can collaborate.
Absolutely.
Not only that, actually I was proposing to a university president now about the possibility of such kind of project in the university.
Yes.
So the president university so he's very interested, absolutely interested in that kind of possibility.
Absolutely. So, for example, we've explored a couple of different options. We've not tried this with Japan, but for our India work, we often have senior undergrads or even PhD students spend maybe 6 months of their time in our lab pushing some of this work, right? So they have some cultural competency and cultural context and so on. And it's fairly easy to do that if it's a visiting scholar. I mean, we've done this the last 3 years. We've had somebody or the other from India doing some work. So something like that is totally doable.
Very much.
Yeah.
Let's talk about stability.
Yeah. Yeah.
All right, thank you so much. So
Thank you.
for the detailed clarification. So the floor is open. Yeah, please. Yes, Kawase.
Thank you very much for your interesting lecture. And I came up with my opinion about the Japanese idea of happiness. So you mentioned why we in Japan, we are so unhappy in such a decent society. And in my opinion, Japanese people are too much demanding about being happy, and Japanese people are too strict to ourselves and to others. And I think Chinese people are very lenient and tolerant to themselves and others, and I prefer them. But in Japan, we have to achieve a lot of things to identify ourselves happy and get married, have kids, and have house and go travel, and sometimes show off how happy I am. That is necessary to identify ourselves happy, and it is very, very difficult. And I think it is very difficult all over the world, but it is mandatory in Japan to be happy. And I guess it is same in South Korea, I guess. But at least in Japan, that is the case in my opinion. And so if we standardize the standard of happiness globally, Japan is not very unhappy. So that is very, very subjective idea.
Yep.
Yeah. Japan require too much.
Yeah, I think even with well-being, the way it is phrased is subjective well-being, right? Because it changes with every person. But with happiness, often there are these outliers or paradoxes, right? So it's not clear if it is a methodological question or if it's a cultural phenomena. Because often when language changes, then culture changes. So are you looking at a culturally distinct phenomena, or is it a measurement error? If it's a measurement error, we want to fix it. If it's a culturally distinct phenomena, which you seem to be suggesting, then that is fine. That is good.
Yeah, and I think not only being happiness, the idea of happiness, I think a lot of the similar ideas such as loneliness is, I think, the same. My question is Buddhist monk sitting on the rock alone, saying nothing about his mental states for several years, lonely.
Yeah. So that's actually an excellent question. So we try and make this difference between solitude and loneliness, right? So solitude is you're not necessarily feeling alone, right? You're choosing to be alone. Whereas, which I think all of us should at some point. But loneliness is when you're actually feeling alone and you're feeling like you don't have anybody else, right? And in the Buddhist monk case, you're physically alone and you're in a place of solitude. In the psychological loneliness state, you're with a lot of people and you're feeling alone, right?
And how do the social media affect such kind of things?
Yes, yes. It's a chicken and egg problem actually. So there are studies that say the more you use social media, the more lonely you get, and there are also studies that say the more lonely you get, the more you use social media, right? So it's a circular problem. There are a couple of randomized control trials that have basically asked individuals to stop using Facebook for 2 months or 3 weeks.
And I think one of the reasons of such a vicious cycle, so many people showing off the fake happiness.
Exactly. Yeah. So there's this social desirability bias, in other words, and fear of missing out, for instance. But there are a couple of studies that suggest if you're off Facebook for 2 weeks, you're less lonely, you're happier. But also what you do with Facebook matters. For example, if I'm just scrolling what others are doing, that is not as good as, let's say, I'm creating videos, right? Let's say I'm posting creative stuff, then that is a little different than just endlessly scrolling. So yeah.
Yeah. Thank you.
Yes, thank you.
Right. So any other comment, question, please?
Yeah, I just wanted to ask about the same question about the targets of social interaction by social media and loneliness. I talk with my children every day, and they are complaining about the useful life of other friends in social media. So they are enjoying going to the sea or Hawaii or great photos and cheerful remarks about friends. But my friends study in Japan. So in the sense, they feel kind of sadness and loneliness. Oh, I have to study in Japan. So it means that social interaction might have some damage on well-being of individuals, and probably our generation we had no social media when we were young. So after 10 o'clock at night, we don't have contact with other people.
Yes.
We never know what other friends do. So we were a kind of lonely, but we feel satisfied. So we could sleep.
Yeah, actually, that's actually a really good point. So the idea of social networks was to bring people closer, but it's not clear if it has done, right? It might have brought people who are far away closer, but at the same time, now you can compare your life with 1 million people, whereas in the past, you could only do it for 10 people. Right? So there's this comparison that creeps in, and that affects the psyche and so on. Yeah.
I don't want to be sexist, but is there any difference between genders?
Yes. So there's actually not a sexist question. There are multiple studies that sort of show that women report higher rates of mental health across the world, right? And I'm not entirely sure about the impact of social media, but in the US, at least, there are some preliminary studies that suggest that teenage women are more impacted by social media compared to other groups, which is leading to actually a adolescent mental health crisis.
In any countries?
There is some work in the US, but women in general across multiple countries have suggested higher reports due to, again, various societal factors and so on.
My daughter feels more loneliness than my son.
So that's an end of one data point. Yeah.
So any other comments or clarifications, please?
I have a question to ask. You talk about a good relationship, which is really important. I do agree with that point. So I'm just wondering how people with different job backgrounds perceive events, which might trigger stress or anxiety. So do you think it's an important issue, or does any stressor which can amplify impacts of social media on the stress?
Yes, excellent question. So I was actually just reading recently that a lot of work-related stressors in Japan are predominantly worse in men compared to women. And there are multiple theories around this, but I have seen this in academia a lot. For example, now in Twitter, a lot of Twitter is used to share academic good news. For example, I have published 10 papers in the last 1 year, right? I mean, not me, but somebody might just post online, and now somebody else with not the same amount of resources might look at this announcement and be like, why am I not able to do this, right? So there is this FOMO again, fear of missing out. So work-related stressors, I think, have been amplified because of social media. J.S.T, actually, he's a psychologist. He does IO organizational psychology in Purdue. He has looked at how social media can be used to understand work-life balance, for example. And how do you sort of look at good life in general? And he says that Facebook has a lot of signal to measure work-life balance. And if you do it well, then you can use social media to also create interventions, right? Yes, you can measure work-related stressors, but you can also use social media to create interventions to reduce those stressors. Now, how do you do it is something I'm not entirely sure, because it really depends on the job, and it really depends on the structural pieces around the job. So I don't have an answer there, but I think J.S.T has more insight into, it is possible. I don't know if I answered your question.
Yeah,
Okay.
really good.
Okay.
There's another thing I would like to ask. So you talked about the database. So do you have access capability to medical data source in Japan?
Not in Japan. So we only have access to, I think, Gallup, and there was this other data set from ESTAT, I think. So it's official statistics of Japan. It's like census, I think. But this is not health. It's not just health-related data. Most of our health-related data is in the US.
Exactly.
Okay, so maybe for myself, just a brief question.
Yeah.
Since you're from this computer science background, can I ask you something about the interconnection, the meaningful, like for example, grant proposal. I mean, meaningful for us to implement in terms of linking this data. IT technology thing, and also well-being related issue, because we also here in Japan we all have to submit grant proposal, etc. And so, what is the state of the art issues blending IT technology and well-being related issues. So for our information.
There actually most of these grants, at least in the US, they have two different focus. One is measurement, the other is intervention. Interventions have higher funding rates, obviously, because you're trying to improve well-being. Yeah. But our philosophy has been, if you cannot measure, you cannot intervene. Right? So a lot of our preliminary grants have been around measuring population health. So can you use, for example, Twitter or conversational data to measure how people are feeling? And if the more specific the population, the better. For example, in the US, there's a huge racial disparities issues, right? In Japan, I don't know what the disparities is. Maybe it is rich and poor, or maybe it is immigrants and non-immigrants, right? So there are specific subpopulations that are more prone to mental health or worse well-being outcomes. Can you sort of use these AI tools to measure well-being in disparate populations? If yes, then can you design interventions to improve those opportunities, right? So, the state of the art is really depends on your population, right? Because if you have a lot of data, then you can use language models and transformer models and so on, which need a lot of data. But if you have not so much data, which is usually the case with our kind of data sets, then we usually take more preliminary natural language processing approaches.
Right. Natural language.
Yes.
Okay. So measurement should come first, definitely.
Yes, unless you already know that this is the specific population that you want to treat.
So maybe a mixture of measurement and also this intervention aspect.
Yeah.
It could be a good package as a grant proposal.
Actually, we submitted something just last week on older adults living in senior homes. So in the US, we have subsidized senior living because a lot of older adults cannot afford rents in the cities. So the government rather subcontracts it to other agencies, and they have senior living homes. And loneliness is a big issue in the elderly. And Japan, I think, also has a very big elderly population, right? So can you do something using conversational technology to A, identify the degree and kind of loneliness, and B, to improve loneliness by having some sort of community strategies and so on. Right? So that we just submitted this last week in the US, but I'm sure that's a problem across the world.
Right. Any other intervention?
I have two questions about China.
Yes.
Just from China.
In China, we
Yeah, both of them.
Three.
yes, we have many popular social media, perhaps WeChat and Read. Yes, and my first question is why your team choose Weibo-based to analysis? And my second question is, did your team find some interesting results about China case?
Yes. So we chose Weibo because there's no secret there. It was available. We tried Renren, we tried WeChat, but it was just not feasible to get data from there. So we worked with Tsinghua University and Chinese Academy of Sciences, CAS, who provided access to Weibo for 1 year. And then we used that data to build on the Weibo data. So that was the only reason. We would love to get access to Renren or WeChat, but we just don't know how. Right. The second is how people talk about their mental health or well-being is very different in China compared to the US. Right. So, for example, I was giving you the example of self-declared depression. In the US, we had almost thousands of people go online on Twitter and say that I have been diagnosed with XYZ. Whereas in China, you can basically get them in fingertips. That's 5 people, 7 people out of millions of people, right? That does not mean that Chinese people are not depressed. There is a section of people who are depressed, but the way they're talking about their health is very different. And we don't know what words they're using. So there are these culturally specific, nuanced expressions that is very specific to China, as it should be, which is very different from the US. I don't know if I answered your question, but yeah, those are the 2 reasons.
Yeah.
Later you can discuss. Yeah, in the morning, in the afternoon.
Yeah, my question is connected because I believe you did and you're doing a lot of studies in different languages, different places. So what's the difference when you let's say when you're processing all the data in different languages, or is there any let's say difficulties to when you're dealing with all the different languages?
Excellent question. So yeah, so there are 2 different methodologies we use in general. One is a dictionary-based approach. So, for example, you might have heard of lexicon. So essentially, you have different categories of words, and psychologists have gathered together and said that the lexicon with the category of work has 20 different words. So essentially, it's a pre-built dictionary. When you try to use a dictionary that is made on English, let's say in Japanese, it will just not translate. Right? You can use Google to machine translate, but it only gets you so far. The second approach or methodology that we use is looking at the posts themselves. Right? So we call it open vocabulary approach, where we are not limiting to specific dictionaries, but we are taking a data-driven approach. We are looking at every single word that people have used, and we are seeing which words are most predictive of, let's say, loneliness or mental health in general in each of the countries. So that way, we are not biasing ourselves to a pre-made conception that these words are important. Right? So that, I think, is the single biggest difference. Again, methodologically, we need to be careful about how we tokenize words. or how we split text into words. Because in English, it's straightforward, you have a space. Whereas in Mandarin, you don't have a space, right? So you need tokenizers, which are specific to those languages. And similarly with Japanese, we were talking, there are three different, right? So you need to convert everything into kanji or, and then apply appropriate tokenizers. So the first step is a little crucial, and the following steps are more or less straightforward.
So the main structures are kind of
Similar. Yep.
So you will just make some maybe smaller adjustments.
Correct. Which needs more domain knowledge, if you will.
Right. Thank you so much. So shall we move on to the Professor Kobayashi's session? Is that all right? Okay, please.
Yes.
Additional concerns.
How about your link with positive psychiatry?
So yes, so we looked at, for example, life satisfaction and subjective well-being. The challenge has been we've not gotten good data outside the US. Gallup has the Cantor ladder and a couple of measures, but we've not yet at least looked at how this is available beyond the US. But Johannes, who's a psychologist, he is looking at well-being and Cantor ladder and life satisfaction across different countries. Basically, he calls it the story of well-being across the world, and we are interested in that. We are actively looking.
Is there any investigation about the relation between politics of education and the United States?
What of education? Sorry. Politics
of economy.
Oh, politics of economy. Yeah, that's a good question. So we actually did some work around in the US again. Did Trump getting elected make people more depressed? Right? And because there was a lot of hearsay that people are just sad. I mean, I was there in 2017 in Boston Psychology Center the day after the Trump election, and some of my colleagues were actually crying. Right? They were like, "Oh no, we are just doomed." And we wanted to basically test using multiple data sources if there was indeed a significant difference in mental health, and the answer is no. Trump election did not make people more depressed. The country did not become more depressed. The health outcomes did not become worse. Sure, politically you might not agree with Trump, but that event itself did not make a difference. But to the other question of economy, we do see that higher education and higher income are typically the biggest predictors of positive well-being, right? But at the same time, there's a small paradox in the US at least. Black Americans typically do not have the same level of income and education as the white Americans. And yet, you see that the rates of depression is not higher in Black Americans. Similarly with Asian Americans, for example, people from Japan, China, and India, and so on, in the US, you don't really start with the same income and education that a lot of white Americans do, but the mental health outcomes are not worse, right? So there's this paradox of lower income and education still not leading to lower or worse outcomes, which has to do with, we don't know the answer to why that is the case. But there's maybe a community feeling where, among Black Americans at least, there's a big community feeling, right? Similarly, with a lot of Asian Americans, there's a big community feeling, which may be protecting against worse health outcomes. So even when we control for income and education, there are other factors at play which play a role in well-being. Does that make sense?
Okay, so a group proceeding some investigation relation between finances and the education politics and going on?
Yes, totally. So because this is a recent paper that I was talking about. As soon as this paper got published, we got a lot of letters essentially saying, "Oh, you're just talking about income and education. That is driving this whole story." But we showed that it's not just income and education, right? There are a lot of factors at play, and we need to be a little cognizant of those factors. The biggest challenge from the data side is we do not have sufficient data from, let's say, rural areas, let's say from poor people, right? Maybe because of access, maybe because of whatever reason. We don't have a lot of data from the minority individuals. So one of the big focus of this is to design studies that are representative of all individuals and not just the majority class. Yeah.
Thank you so much, Dr. Guntuku, for your really, information-rich, interaction and presentation. And so maybe the discussion will continue because Professor Kobayashi will be using his own PowerPoint file, but maybe he will be referring to your sort of research issue along the way, right? So.
I study political philosophy, and I'm now exploring the relation between political philosophy and positive psychology, and for the idea of positive political psychology. So this is our main focus. So this team are interested in the topic of the fairness. So the relation of the fairness and positive psychology on well-being. So these are the our basic concepts about political philosophy and psychology. I cut off these issues. So, for example, we measured the well-being level in Japan, for example, during the Corona calamity and so on. So we have published some of these data in with some of my members. So these are the very subtle data. So I would like to give you a book about this, right out later. Yes. So this is okay. And so the relation between wellness and fairness in Japan is our main focus. So, for example, how about the relation between biological factors and socioeconomic factors and wellness? This is the main issue. So we have analyzed this issue and proved that the factor of justice for citizenship or fairness influenced the level of well-being. So this is our present focus. Okay, these are the products of the study. Easily catch up. Okay, this is the background. So on the present. And we have analyzed the relation between the fairness and the health, mental health, and somatic health, or psychosomatic health. So we found that there is a serious and health disparity in Japan, which is influenced by economy and social stratification and so on. So there is a concept of health disparity. So we found that this still exists in Japan. And so this is an ongoing investigation. And this was based on our research in last year. So this is the most recent year. So I like to investigate the relation between character strengths and well-being. First, you're familiar with this topic. And I learned this topic when I was in Pennsylvania in other psychology. And so we found various articles on the relation between the two. But I haven't known any article in Japan. So this is actually the basis of positive psychology, you know. So I'd like to prove this in Japan. So I'd like to ask your opinion or a recent trends or a recent information on that topic today. Okay, so and obviously there are three pillars of psychology: well-being, character strengths, and institutions. And our focus is institution or public matters in the third one. But this study is relation between well-being and character strengths. So you know that there's a very important hypothesis that character strengths, virtue or character strengths increases well-being. And I have read some articles on that. So I'd like to investigate or validate this plan. So we found that, okay, we titled this one. There are relation between average of beer and established in Japan too. So, and there are correlation between beer and virtue. So, this is the correlation between virtue, 6 virtue in beer, and SWLS. So these are we are familiar with such kind of correlation in American data and so on. But this is the first data in Japan. Yeah. And so this is the relation between each beer and PAMA in this case, an indicator. Okay, so the conclusion first, the higher beer, the higher well-being. Such kind of relationship can be found even in Japan. And so character strengths may increase well-being. Obviously, there can be 2 kinds of correlation. Well-being increase character strengths, or character strengths increase well-being. That's the most probable direction is character strengths may increase well-being. My first question is that is there some study concerning the direction of causation? That's my first question to you. That's right.
Okay, so I have not seen a causal study yet.
Right.
You could, for example, especially it looks like you have multiple time points of data.
Right.
So you might actually test this.
Yeah.
And there are multiple ways to look at observational data and causality. One simple way could be just looking at Granger causality and seeing if A predicts B, but B doesn't predict A. That means that the direction is A to B.
Right.
I have not seen, but also I'm not an expert in character strengths. So there might be studies, but I've not seen one.
Really? You haven't seen? Okay. So is there any substantial progress in that topic recently?
So one of my colleagues, actually Dan Pang, she was also at Positive Psychology Center, but now she's at University of Bern.
Right.
She recently published a paper looking at character strengths and how they manifest on social media. And something that they were talking about is there's this factor structure in different virtues and different traits of character strengths. It is helpful to identify what that factor structure looks like. For example, even with PERMA, even though there are 5 factors there, if you run a factor analysis, most of the pieces load into 2 factors. And if you look at those 2 factors, that might give you more insight rather than splitting it into 5 dimensions. So similarly with virtues, I think there's a factor analysis that might be specific to Japan.
That's very interesting. What's the 2 factors?
I don't know.
Okay, I'll ask you. I'll read it.
Yeah.
Okay, I know. Just, actually, I'd like to make factor analysis on the relation between the virtues and character strengths. This is done by VA Institute and so on. Okay, so this is the conclusion first. And the second one is character strengths in life. We have investigated between the character strengths and income, health, education, human relations, and achievements. And so this is background information. And so we can see there are the relation between average of beer and income. Basically, the higher beer, the higher income. So we can confirm this point. And so average and beer and health inclusion ratio of nature. This is basically the highest beer category is healthier people than usual people, not extraordinary vital people. So the healthier 2 categories have higher beer than the less healthy 2 categories. So some kind of correlation between the health and the beer. This is the human relationship. Actually the same. Basically the higher beer category is people with better human relations than usual people, not people with extraordinary good relations. The 2 categories with good human relations have higher beer than the 2 categories with problem of human relations, the same. And the achievements of objects, actually we cut off because the conclusion is the same. And so provisional conclusion 2, beer and life. So the higher well-being, the wealthier, this was verified in our another paper. So well-being may increase high income, but high income may also increase well-being.
Right.
But how about the relation between the wealth and VIA? So we can find that the VIA may increase income. So perhaps this causation is more plausible than the other way around. Income may increase VIA. So that's why imagination. So my first question is there a kind of causation problem? This one is very similar to my last question. So basically, the highest VIA category is people with health, human relations, better achievements, objectives than usual people, not people with extraordinary health, relations, and achievement. And the two categories with health, human relations, and better achievements objects have higher VIA than the two categories with problem concerning these. But accordingly, health, human relations, and achievements have an association with VIA. Hopefully, this was the analysis based on the subject recognition of the respondents themselves. But we are trying to use some kind of objective data based on people's subjective recognition. Not only the, for example, subjective is subjective health and so on. So the direction of the causation should be explored. So this is my projection conclusion second. So my question is similar. So do you know some recent knowledge on that topic? Right?
So this is actually a very difficult to get the causality.
Yes, indeed, indeed.
There are some works, for example, we look at the relationship between well-being and income relative to neighbors.
Right.
For example, if I'm in a neighborhood where others make similar money, salary that I do, then my well-being is likely to be better. But if I'm in a neighborhood where everybody else is making more than me, the well-being is less likely going to be bad, even though the salary that you make in the second scenario is higher than the salary you make in the first scenario. There's a name for this paradox, I forget. So some of this could be looked at the community level because you will likely have how neighborhoods changed over time. But I have not seen, for the most obvious thing, at least that I've seen, is income has a direct causal effect on VIA. But your proposal that VIA may increase income is plausible, but I don't know how to test it unless you have community level data.
Okay. My impression is that there are a lot of studies concerning the relation between well-being and income on the other points.
Yes.
But I have seen not much paper on the relation between VIA and those points.
Yes, yes.
I wonder how. Do you know the reason?
I think it's, again, it has to deal with maybe how, for instance, PERMA, I can give you an example of PERMA. The 5 factors are really good if you want to develop interventions and so on. But a lot of them more or less fall into 2 factors. Right. So similarly with character strengths, with all these different factors, it's not clear if they're independent or if there's a lot of multi-collinearity.
Oh, I see.
Right. So that sort of muddies the water.
Okay, I understand. Okay, thanks. So there are the second topic about Aristotelian golden means. Perhaps you know about the VIA Institute studies on the too much or too little on VIA. So that's the first point. Actually, I actually studied political philosophy. So my first point is that the relation between philosophy and political psychology. So obviously, political psychology said that and VIA or character strengths can increase well-being and so on. But Aristotle says obviously golden means. So what the relation between the two? My first point. So we increase. Made our original Aristotelian golden means. I cut off the detail, but anyway, we use these questionnaires. So the result is very interesting because the largest relation between SWLS and virtue is 0.5 to 8. So 5 is means. So 8 is a bit bigger. 9 is most bigger. So this can be in tune with our original supposition that the golden means is a very important in there. So this is a slide. Golden means about not 5 and 6 is the biggest in SWLS. And so cutoff region, but anyway, and this is the average of deficient means excessive categories in the same. We cutoff. This is a palm, so we can see the 5 or over 6 is very top. Okay, so the professional conclusion too. Basically, well-being of excessive virtue and deficit virtue is lower than some middle point. Therefore, Aristotelian ethics in this point is verified. Aristotelian golden means concerning S corresponds to 6 or 5 to 6 in this questionnaire. So the Aristotelian golden means may be slightly higher than the subjective mean. When we define 5 as means, well-being of means concerning each beer is sometimes the highest, but well-being of excessive is more often the highest. Well-being of excessive is higher than deficit. Of course, I don't know such kind of similar studies. No?
Actually, I had a question. So in your previous findings, you said that none of the extraordinary categories were predictive of well-being. Right. So, but here you seem to suggest the other way around. Is that
right? Okay. So this is the relation between average of SWS. So, 6 is the highest. 5 and 7 are a bit lower than 6. But we can see.
Yeah, I don't know why this is the case. It is sort of counterintuitive.
So not 5 actually, more bigger, but not 8 or 9. So this one. The problem is that
the alignment here.
Right, and so Ryan now exploring the golden means in general. I contacted with him and he provided us with new questionnaire, but he hasn't published yet. So we can say details of that. So we use his questionnaire form. You can see 8 is the biggest, not 6 or 7. So sometimes similar, but sometimes different. So,
and this is in a population sample or a random sample? Or?
Right, and we use the 2,050 people by the Internet Survey Campaign.
Oh, okay.
So that's the point. Yeah. I'm not sure of the meanings, but I cut off the details. But anyway, this can be seen easily. So 8 or 8.3, 8.9.
This is fascinating.
Right, but 9 is all down.
Yeah.
But the sample size of 9 is a bit little. So I'm not sure whether this can be statistically.
Is it because not a lot of people want to give a score of 9? Like for happiness, people don't want to put a score of 10.
Right.
Maybe 7 is the highest.
Right. Yeah. So I'm not sure if there's a cultural difference between American and Japan at this point, but this is the the similar points. Okay, so conclusion 4. Basically, well-being of the most overuse and unused beer are lower than middle points. Therefore, this result is compatible with Aristotelian ethics. However, Aristotelian golden means concerning well-being corresponds to 8 in this questionnaire. So the Aristotelian golden means may be much higher than objective mean. When we define 5 as means, well-being overuse is the highest. Well-being of the mean is higher than the deficit. The conclusion above is very close to the former analysis concerning beer. The difference between these is related only to the category 9. So there is some similarity between our questionnaire and Ryan's, but some difference between two. I'm not sure of the results. So this is the point which we have to explore further.
Yeah, especially if you can administer the same questionnaires with the same people. That will, I think, be very helpful. For example, we've done this a couple of times where we use Qualtrics, which is a survey company in the US. And over time, the quality of the panels has just gone down. So the quality of data we get after we pay them is not good. But there are other platforms that are giving slightly better data. So that could also play in, in the quality of the panels themselves might play a role. So I don't know if that will be a problem here, but something that we've seen.
I have to go make a position with reading session, but anyway. So I think it's better to make this study into some kind of article paper. Do you think it's worthwhile doing?
Yeah, totally. Especially if you have it in the same set of people.
Right.
And if you see that this sort of differs from what people are publishing in the US, then you clearly have a culturally interesting story to tell.
Okay. Thanks very much.
Yeah,
So
thank you.
give us the advice about it. Okay, that's all.
Right. Well, thank you very much, Professor Kobayashi. So, any clarification, comment, question, please? I mean, on this today's overall issue. Yeah. Either to Dr. Guntuku.
This is the first point which I made some investigation into Japanese too.
Yeah, I have a question.
Right.
So you mentioned about justice and fairness.
Okay.
So how do you define justice in this context?
Okay. Actually, in the theoretical paper, we define justice and fairness by a 4 dimension. But in this research, we only use a simple question. So do you think, how much do you think there are fairness or justice around you or in Japan? This is subjective definition of justice and clinical research.
What are the mean values? So do people think that there's a lot of justice around them, or do people not think that there is justice around them?
So it is very interesting that actually at first I haven't imagined such kind of correlation between paper recognition, justice and fairness and well-being. We found there are actually. So
maybe if I had to guess, I would guess if somebody thinks that there is not enough justice, then their well-being will be lower.
Right.
Whereas if somebody thinks that there is justice, their well-being will be higher.
Oh, yes.
But I don't know if that's what you're seeing in the data.
Actually, in the questionnaire, we have asked several questions concerning justice and fairness, which were, for example, first is more equality, second is rule compliance, third was ethical fairness and so on. So I haven't analyzed that part in the future.
Yeah. That will be fascinating.
Thanks very much. Yeah.
Any similar research going on in the US? I mean,
definitely with character strengths. Again, this is not my area, but Johannes Eichstadt and Dan Pang, they've done some work around character strengths. I can share those papers with you.
Thanks very much.
And with respect to PERMA, one challenge has been the factor structure again.
Yes.
Similar to, I think you might have heard of other constructs like grit, which is very similar to conscientiousness. Right? So there's some ongoing work around, for example, in school students. There's this collaborator of ours, Angela Duckworth, who has done a lot of work around. It is not how intelligent you are that predicts if you'll succeed in school, but how gritful you are, how perseverant you are, right? So how can you measure grit and how can you use grit or coach people in grit, right? So that's, again, very similar to one of the character strengths values, which we are looking at. Can you build conversational agents to talk to students and improve coaching outcomes?
Okay. So I have one point about the intervention that you raised. I mean, measurement first and then intervention. So Professor Kobayashi and I mean, together with Mizushima, of course, have been working on this research agenda. Okay, maybe intervention at the prefectural level here in Japan, and then so when you talk about intervention, what could be the kind of intervention? Is it regional, like state by state intervention that you're talking about, or like medically oriented intervention? So what kind of intervention you frequently talk about in the US?
I mean, at least the way we are thinking about is it in two different ways. One is individual level intervention.
Individual level.
Can you have, for example, in this case of school students, we work with individual students and see if talking to a conversational agent will help in improving their grit, right? So that's a very individual level intervention. But there's also regional intervention where, for example, we can use Facebook ads right? Or we could use Twitter ads, and we could show them to multiple people across a prefecture and see if that exposure makes a difference in how people are responding to, let's say, health-based news. It's a little more challenging to measure it at the regional level, right? So sure, people are seeing your ads, but how do you measure if that has any input on their behavior? Right? So in that case, the regional ones are a little more tricky, unless you can work with some community organizations. For example, I talked about very briefly our work with elderly individuals, right? So older adults, in which case we are directly working with the senior living homes, right? So at that point, the intervention can be at the community level. If you think that having a group activity will improve loneliness, then you can test that in one community, and you can have a placebo in another community. See if this intervention actually made a difference to the entire community or not. Right? So, yeah, but if it's state level intervention, it's a little more challenging unless you have direct access to Facebook, for example. There are a couple of researchers who looked at whether showing misinformation ads or whether correcting misinformation leads to better vaccination outcomes and so on. It's a little tricky. The biggest predictor of somebody getting vaccinated is just giving them access to the vaccine. Other interventions don't really make much of a difference.
So do you work at intervention community level with collaboration with community organizations and so on?
We are just still getting started with that. Yeah.
Okay.
Because I don't have expertise in intervention, but we are starting.
I'd like to ask about the correlation between the freedom of speech and well-being. For example, in the political protest movement in the Arab Spring, I heard some social media made a lot of difference. So is that the reason? So did it improve the well-being or wellness of them or not? So I think that can work in a different way. So that sometimes that may worsen make it worse about the well-being people. And in the case of Arab Spring, I think it works in a good way. I think. So yes. Anyway, I want to ask about the freedom of speech and well-being. So the political freedom of speech and well-being.
Actually, there are items concerning political liberty, including speech and political participation. So in your data, we have a correlation between those two items and the well-being. So we can imagine that there can be some kind of substantiation between the two. We haven't analyzed the impact of other factors in this correlation, but anyway, imagine that the political participation and political liberty has some impacts on political liberty. And this was one of the dimensions of our justice. 3 or 4 dimensions of justice. One dimension is political freedom.
And I am afraid of that it is very, very difficult to make the models or general theory about that kind of thing because it is so complicated and that is always case by case. So, for example, in Hong Kong and in Arabian countries, that is very, very different. And is it possible to make some theory of that?
Yeah, I imagine. But the data can change from time to some place. But I think it's better to accumulate.
Of course. That's
any kind of idea.
So actually, it depends on multiple things, but a couple of pieces that we've been thinking of is there are these cultural dimensions. You might have heard of Hofstede's cultural dimensions, individualism, collectivism, power, distance, and so on. Some of these also have interactions with how political freedom and so on are viewed. The second is what is the domain or topic of such a piece, right? So, for instance, in the US, there was a huge Black Lives Matter movement, and we've seen that when those protests started, the loneliness levels reduced, right? So which is sort of, in retrospect, yes, that makes sense. But if you were to forcibly stop those, then it will not achieve the same purpose, right? So it really depends on, I think, what the domain is and what culture we're looking at.
Yeah, I think anyway, the case study comes first and accumulating the data,
Yeah.
and the general theory is next.
Yeah.
I think.
Yeah.
Thank you anyway.
So, in our comments mentioned any scope for collaboration in a loose sense, right? Because what we went to invited a scholar in this field, and then according to his observation, it's a really interesting topic. But when it comes to collecting a comparable data set in two different countries, it might be a too much. So much of our work needed, but in a from a different scope, it might be possible to make some kind of a comparative study in a loose sense. But what would you think about the scope for like loose sense collaboration?
Absolutely. So the study that I talked to you about Weibo in China, that's a very good example of a potential loose collaboration.
Okay.
So there, essentially, we had a lot of Weibo data, but we did not have the quote unquote ground truth data, right? So if you have access to any Japanese prefecture level data, we already have Twitter data, right? We can look at, for example, how language of well-being is predictive in Japan, and we already have models in the US, so we can sort of do a compare and contrast sort of a study, be it well-being or mental health or something else. It really depends on what is available. I agree that collecting parallel data is really tricky. We've been looking at, for one of our existing projects, trying to collect data across 7 different countries, and it is incredibly challenging because no single company has people across multiple countries. So yeah, we are still thinking about that. But the other aspect, I think, is doable.
Right.
So if you're interested in, let's say, well-being or specific questions around health or ethical pieces and so on, we already have the Twitter data. We can basically map it to some of the survey data that you have, and we can look at some of the similar analysis that we did together.
Final comment. Yeah, there's something, right? All right. So thank you so much, Professor Kobayashi, and also Dr. Guntuku, for your really meaningful and state-of-the-art intervention for today. We learned quite a lot. Some of us are very new to this issue, but we are learning a lot from this kind of seminar. And then we wish to, like I said, loosely continue to collaborate with each other, hopefully. Yeah. So thank you so much, Dr. Guntuku, for coming over here today. So can we just close this session at this point in time, and then move on to the frank lunchtime session, for some of us, right? So thank you so much.
Thank you.
ありがとうございました。